Hi, good morning. This is Edward Ng from the Pittsburgh Foundation. Welcome to the monthly COVID call. Just to let everybody know, this is being recorded for uh, distribution, and that's really it. If you would hold all of your, actually, if you hold all your questions until the end, or sorry, put them in the chat, we will answer all of your questions after the webinar. Other than that, I'm going to hand it over to McCray Martino, the Executive Director over at Community Foundation, Westmoreland County.
All right, thank you so much, Edward. Good morning, everybody. Happy rainy Thursday. Before we jump in, we're lucky to have artwork on our PowerPoint each time from the Westmoreland Museum of American Art. And I'm just going to read you a little bit of information about the piece that you see before you. This is by Joseph Woodwell, who was born in Pittsburgh, but spent many summers in Magnolia, Massachusetts, painting the water and the rugged coastline in a manner that brought out a brighter and more painterly technique than that seen in his landscapes of southwestern PA. It's clear in this painting, Seascape, as in others, that Woodwell responded to the specific characteristics of the subject before him, working with the economy of brushwork and detail in order to capture the essence of a specific site, season, and time. So thank you to the museum for sharing that with us. So for today's call, I know normally Dr. Fox is early on the agenda. She has a prior commitment, so she'll be joining closer to the end of the call. So if you're interested in hearing an update from her, you'll want to stay on. Make sure you stay on the call until then. That's really how we just get you guys to stay on the call. Put her at the end. In the meantime, I would like to invite Commissioner Sorelli Thrasher if she has some information or any updates she would like to share.
Great, thank you. I don't have any updates. I just like to get on this call to hear everybody else and just want to say thank you to all the partners for everything that you're doing in the community. And my colleague, Commissioner Doug Chu, will be presenting today. But again, just want to say hello and hear from all of you. Thank you.
Thanks so much, Gina, for attending. I would like to now welcome Commissioner Doug Chu to present. Thanks, Doug.
Sure. Thanks for having me this morning. Could you advance to the next slide? So these are things that Commissioner Sorelli Thrasher and I both have worked on. I happen to make the slides, but she's been equally important in getting these items assembled. I wanted to make sure that we're bringing to people's attention the Emergency Rental Assistance Program. In Westmoreland County, this program is very well funded. There's $20 million, but we have only used a small percentage of that money. And so on these slides, which I believe are available also after this meeting, right, McCray? Alyssa? I see you nodding your head, Alyssa.
Yes, they will be. Thanks.
Okay. So I was really detailed on this slide deck so that people really knew all of the possibilities that this program can offer. So if you are in a rental situation and you are unable to pay your rent related to COVID or any of those utilities or late fees to the landlord, all of those things are able to be covered by this Emergency Rental Assistance Program. And then can we go next slide? There's also opportunities for people that are homeless. And so we can cover moving expenses, security deposits, etc. And so like McCray said about getting people to stay on the call to hear Dr. Fox from Excella, Dan Carney from the Union Mission will have a lot more details and can answer very specific questions about this program because his group has been an excellent county partner in getting this money out into the community. Next slide. Another program that has come up this year, and I've mentioned it at least once on this call, is the Commercial Property Assessed Clean Energy. It's not necessarily a mental health issue, but it is an important program that the county started. Private property owners can get access to very low interest financing in order to update their energy systems, for example, their lighting, to create a more modern, efficient system. And that helps all of us maintain costs and things of that nature. Next slide. The American Rescue Plan, the final rules are still not posted. We did talk this week about some county engagement being scheduled for late October, early November, but without the final rules still posted, it is very challenging to move forward with that. My colleagues and I are disappointed that we don't have those yet. They've been promised since early July. Next slide. Recently, we have advertised looking for van drivers. Our veterans program does a assistance program where veterans can get a free ride to the VA Pittsburgh for their medical appointments. We have the vans. You just need to get signed up and get approved, but we could use free van drivers to help us get these veterans down to Pittsburgh for their important medical appointments. Also on this slide, another program I've mentioned briefly in the past, but hasn't been used very much. It's the Healthy Homes and Lead Hazard Reduction Program. And I think all of us on this call realize that lead builds up in the body over time. Children under 6 are the most affected. Children absorb lead about 2 times better than adults. And so that's why it's really important that we keep these things in mind. It's not so much an issue for those of us that are ancient like I am, but it is an issue for our children. The lead that's in the children can affect their mental abilities, their long-term health, their other health habits. Lead is a heavy metal, and so it's really important that we try to work to get that out of the county. We have $3.4 million available to mitigate lead in county homes. And we have had not too many calls for it. And so my goal in presenting it is so that you and the mental health providers in Westmoreland County are aware of it. And if you happen to run into somebody that has a higher than normal lead level, that you can recommend the program. If you're a contractor, you can get free training and certification in order to do this on future projects and homes. Next slide. And this is my last slide. This is new since the last time I presented. Are you prepared for an emergency? That's something that we're really talking about on this call quite frequently. And the county's local emergency planning committee has finished its 2021 Citizens Guide to Emergency Planning. I've looked through it, passed out a few copies, and it is truly an excellent book. In order to make it easy for everybody, I didn't put any URLs inside of the slide deck. I just put the one phone number at the top. It'll ring the commissioner's suite, and we can help you find these programs on the website because the URLs are a little bit long. And so it's easy for us to then email them to you so that you can find information about these programs. As always, thanks for everything that you do. Thanks McCray and Alyssa for keeping these calls going. And that's all that I have for this week. And I'll turn it back over to the organizers since my boys have started singing.
Thank you so much, Commissioner. I have to apologize before we jump to Sarah. I was so distracted by the dogs barking that I forgot to give Alyssa the opportunity to share a United Way update and to thank her for also partnering on these calls. So Alyssa, I apologize. And please, let's hear your update.
That's totally fine, McCray. I have boys and dogs as well. So I understand, and I think Doug does as well. So thank you. And thanks, Commissioner Cirelli and Chu for being with us today and sharing that information. It's really important. I wanted to just give a quick United Way what's going on overview. Tomorrow actually kicks off our week of caring. We have some 15 projects this year. We're doing it over the span of a week. Those of you who've been around for a while probably recall Day of Caring when we had about 45 to 50, maybe 70 sometimes projects going on and hundreds of volunteers out on one day. We have changed this starting last year and this year to be a regional event. Of course, we have all the complications of COVID-19 to deal with, so the numbers are less than they had been in years past. But the good news is we're still able to get out there and help a lot of our nonprofit partners. And it's just always impressive all the work that the volunteers can do and what can be accomplished on this now week instead of day. So there are opportunities to volunteer together as a family over the weekend, and then through our company partners as well. So it's always a great time. And thank you so much for the partners we have on the call, the providers, where we will have people coming out to help. So thank you. I took a look at some of the 211 data, and calls are still up this year compared to last. I was looking at the last 30 days. Most of the calls, we had over 1,200 calls, and then there's additional texts and et cetera. 37% of those were for housing and shelter, and 80% of the calls were around rental assistance. So still a big need that we see. 41% of the calls were about utilities, electricity, gas, and water. Interesting to note that Westmoreland County had the #1 in that. So they compare all the counties and where the calls are coming from, and Westmoreland County had the most calls around utility assistance through Southwest Pennsylvania's 211 footprint. So I'm going to see if I can dig a little bit more into that, just to see how we compare with some of the other counties. And the balance were around unemployment, financial assistance, et cetera. The good news is calls for food have gone down from last year. They were about 10% of the calls we were getting this time last year. Right now, it's about 4 to 5%. And I know Jennifer Miller's on the call. She'll talk about that. But I think that's excellent work from our Westmoreland County Food Bank and really meeting the need throughout our community. And just kudos to them for being there. And I know so many of our other providers have stepped in to this space and looked at the homeless rates and the shelter and the housing and utilities. So thank you so much for all of that good work. And we'll just keep plugging along here. We're seeing the calls continue to come in. As always, 211 is a great referral for people throughout actually the state. So thanks, McCray, and I'll turn it back over to you. Good to see everyone.
All right, thank you so much, Alyssa. Next up, we have Sarah Stanger, Administrator in Behavioral Health and Development Services at Westmoreland County. Sarah?
Hi, good morning, everyone. I had shared a brief PowerPoint presentation with some of the upcoming trainings that we have, if that could be shared. Okay, next slide, please. Okay, next one. Okay, first I wanted to talk about this coming Saturday. We have our 15th annual Ray of Hope walk out at Twin Lakes Park. This is for suicide awareness and prevention. We're excited to be back in person this year. We have over 200 people signed up. There is going to be a virtual presentation for suicide survivors in the morning, and then the walk will be at Twin Lakes on your own. But we do have somewhat of a normalcy to it, but it is a little bit different than past years. But you can still plan on attending if you're interested in. You can reach out to my office or Mental Health America for further details. But we are committed to this walk, so we wanted to make sure we could do the best we can, and we are having a little remembrance of 9/11 also included in it. Next slide. We are still having some community support groups, virtual support groups at this time. They are through Mental Health America. If anybody, again, wants any more information, these are on our websites and also Mental Health America. The next slide. We are in the planning process too for our fall training for our emergency behavioral health team. These are our responders that go out into the community at times of crisis, can help with follow-up for disaster teams. It was called DCORD in the past, but the name has changed to EBH, or Emergency Behavioral Health. So we have significant trainings for our staff to make sure that we are addressing the current needs of the community. Next slide. As far as a lot of the human services and anywhere else, we are seeing a significant staff shortages across all levels of care. Mental Health America last month hosted a job seekers fair, virtual events, and they are planning on doing another one this coming September 30th. For anybody that's interested, this flyer will be updated and shared, but I just wanted to have a availability for what is out there. I said we are searching across many systems. We are unfortunate that we cannot even open up a couple newer programs because we do not have the staff to meet the needs to make sure that we can safely open these programs. So I'm sure everybody's in the same boat, but I just wanted to get this out there. Next slide. We are still trying to plan some community events. This one is a Halloween themed mental health awareness event in Scottsdale. This actually is a man that is from that area that wants to promote mental health awareness and community supports. So he is planning it. We want to try to get the word out there. It's October 16th in Scottsdale. Next slide. This is another training that we have coming up. We receive grant money each year for housing trainings. So this is hot off the presses, free trainings for the community. There's 3 different trainings that are all going to be offered, all virtual. So feel free to share this to anybody that needs training hours or help with housing, another issue to try to help with the community. Next slide. And this is, I think this is the last slide we have. This is also for Ray of Hope Suicide Awareness and Prevention Conference. Right now we are planning an in-person conference November 19th at the community college, but we'll have to see how COVID plays out between now and then, but this is a save the date for the conference. We try to do a conference every other year as a free training for the community and providers to really help with as much as we can about suicide awareness. We also have 2 different other, I think that's the last slide I had in there.
Yeah, that's right.
Okay, and then actually I wanted to talk on 2 other different areas for housing needs in the community. I know there's a lot out there for housing right now, but as long as the individual has a mental health diagnosis also, we receive substantial funding to help with housing needs and supports for individuals in the community. They have to be involved with Westmoreland Case Management to receive these fundings, whether that be a linkage through some of the prison programs we have or the community liaisons, but there is substantial funding to help with re-entry into the community for housing, first month's rent, security deposits, if they need medication or furniture. And we are so in the process of working with SPHS to develop some additional housing supportive services for forensic population in the community also as far as reinvestment funding. So we're waiting on finalized state approval for that program, but the forensic funding is available through WICSE. I believe that is all. If anybody has any questions or need anything on our end, please just continue to reach out. Thank you.
All right, thank you so much, Sarah, for all that great information and event information. Next up, we have Bud Mertz, Director of Public Safety. You there, Bud? I can see you.
Hey, Bud, you're still muted.
There we go. Thank you. First of all, I want to thank Commissioner Chu for providing a great segue into the fact that September is National Preparedness Month. and in partnership with FEMA and PEMA and all the other organizations, we've launched a campaign to promote preparedness for disasters in our public. So links are provided, through the county web pages as well as our social media pages and all that. But it's the main idea is to reach out to the public and make sure that they are prepared for disasters or emergencies and the different steps that they should be taking. So thank you for that segue and going into it. We have a lot planned as far as outreach goes with that. Which gets into how fortunate we were over this past week with the severe weather that we experienced. In the emergency management world, we have to stay one step ahead of potential disasters, emergent issues that come in. We were very fortunate. We partnered with the American Red Cross and a whole host of other entities to make sure that they were aware and everybody was on set in the event that from the heavy rains that we were expecting from Hurricane Ida, that it would affect our residents. We even had at least 12 separate swiftwater rescue teams on standby. These folks took the day off of work actually and was on standby to provide rescues. So just shows you how close things can be, because the tremendous amount of damage actually started in Bedford County and moved east afterwards. Went through here. We had a lot of rain. We had a lot of, I think we had 314 calls for assistance from the public, for flooding, trees down, that type of stuff. But fortunately, nobody had to be evacuated. Nobody was sheltered. No injuries in Westmoreland County. So, but it's good to be prepared, and it shows the need for the citizens to be prepared. Tomorrow, we are honored to be hosting Bishop Kulik from the Greensburg Diocese coming in. He's kicking off his 9/11 remembrance for the 20th anniversary of 9/11. But it also gives us an opportunity to talk to the bishop about our COAD program, Community Organizations Active in Disasters, in which we want to partner with the Catholic Charities. And I've already met with the bishop twice about it, and we're working hard to bringing in the Catholic Charities as one of our anchor partners with that, in which we reach out to the social services in Westmoreland County to provide the immediate needs for disaster victims. People that could, have lost everything and what they need. So we continue to build that program strong. And, tomorrow's meeting with the bishop after the ceremonies that he'll provide for the 9/11 remembrance is going to be key to moving forward with a key anchor. So we're pretty excited about that. To talk about the COVID-19 response, we continue to coordinate in between the United Way and Excella Health and Mutual Aid Ambulance Service to the homebound inoculations, as we went through a lot of the first doses and second doses. Now we're obviously organizing the third dose as we speak. So that program is still going strong. We're still working with our key partners in making sure that the public's aware of where vaccination can be received, as well as any information on testing and where those testings can be provided, and trying to get them the best accurate information possible. So those initiatives are going on, and we still are in the logistics side of it, of providing the resources for masks and gloves and everything else that we've been doing throughout this whole thing. So aside from standing up for disasters and doing our normal business, such as the co-ed and everything else that we're doing, we're still active in the COVID-19 response as well. But that's all I have right now, unless there's any questions.
Thank you so much, Bud, and thank you to you and all your team and the volunteers for all the work you're doing and the support and the rescuing you provide. So thank you. Quick note, if you click on the handouts on your sort of menu bar, Edward has loaded the PowerPoint, so you can click that and download it, because I know that Sarah provided a lot of information about events and links and all that, so that's right there. All right, next up, we have Jennifer Miller, CEO of the Food Bank.
Thank you, McCray. And thank you to all of you for hosting this this call again. I think it's very important to understand I'm sorry, everything kind of went blank for me, so I wasn't sure if I was still on. I think it's really important for us to all understand what is out there to refer our clients to, and for us to have that knowledge. So I appreciate this opportunity very much. The food bank is doing well. Our numbers are low, believe it or not. Hopefully that means that everyone is being fed and the referrals from 211 are actually working, and people are getting what they need. We are attributing a lot of it to the fact that the unemployment compensation was still high up until this week, as well as max benefits for the food stamp program. So we are cautiously optimistic that that will continue to be the case. However, at the same time, we are feeling that once the food stamps go down to regular rates, we are going to be inundated with the amount of people looking for assistance. We are prepared for that. We are a bit concerned about the new headlines that some of the TV stations were coming up with this in the last 24 hours, that there was a food shortage around the schools. We have not heard that in our area, but I have heard that in Chester and York County, I believe, that the schools are not able to get the food that they need to feed the children. So should that ever become a case, we need to be aware of that. So please keep the food bank in mind if you happen to hear that. You know, we will do whatever we can to accommodate. We were prepared for the storm. We had emergency boxes ready. We also were in talks with a local vendor to get water if we needed it. So we were prepared on the storm front, basically. We are also looking for assistance with volunteer deliveries. We have a lot of senior citizens who are in need of delivery of their senior food box. If you know of any volunteer who's willing to give an hour or two a month to be able to deliver a few food boxes, even in their community, would be a huge help. We're working with our food pantries to get that set up, and we are really, just like everybody else, just need the manpower. So if anybody is interested in doing that themselves, you know, even if you are working and want to take some time to be able to do that, you know, picking up at a food pantry, we will put you towards the front of the line, needless to say, so that you can get off and running. You won't need to wait in line, and then you can drop the boxes off to our senior neighbors. So if you're interested in doing that, please contact the food bank, or if you know of anyone, or we are going to be putting out some information about that project with getting some volunteers. We are working with DoorDash as well on a statewide level to get those senior food boxes delivered. However, the DoorDashers can only go 10 miles from their radius. So, you know, if they're at the food bank, you're looking at Jeanette, Murraysville, Delmont, needless to say, and, you know, those areas around there. So if you know anybody that does DoorDash, please push them our way as well. People really need to, the seniors really need that food delivery. So another thing we are doing right now, many of you have probably seen our billboards and our commercials that have come out. we were the recipients of a grant that specifically requested us to do advertising for our consumers. So fortunately, that did not come out of our operating budget. We were able to get a grant to do that. So we have also changed our logo, and we are now known as the Westmoreland Food Bank. Legally and officially, we're still the Westmoreland County Food Bank Incorporated, serving the residents of Westmoreland County. So we decided that we needed to brand a little bit more with Feeding America. So you'll see a similarity to their logo. And we're really, really excited about rolling that out, plus being able to advertise to our consumers that we're here. A lot of people who work and do not think that they are necessarily eligible for the assistance do not necessarily think that they can contact us for that help, but we're here for them. So, we are able to do a lot with a little. So, again, I thank you for this opportunity to talk about the food bank and what we're doing. Our amazing staff continues to plug away, and we're hoping that the Delta variant avoids us at all costs. So thank you all, and thanks for the opportunity.
Thank you, Jennifer. I appreciate that and all the work that you all are doing in your volunteers. And if you check, you'll find an email in your email box for me. So next up, we have Deb Thakra, founder from Feeding the Spirit. Deb?
Hi, thank you for gathering us today. I'm going to echo Jennifer's thanks. We so appreciate hearing what everybody is doing and partnering with everyone. This sharing of information is crucial, I think, for all of us, not just at this time, but always. So I thank you. As far as Feeding the Spirit, we've been pretty busy. We continue to do our weekly meal distribution out of our Otterbein Church. We were hoping we could go back indoors in the summer to do it as a sit-down dinner, but obviously that didn't work because numbers started to increase with COVID cases. And so we thought to keep everybody safe, we want to just continue on with our walk-ups and our drive-throughs. And we do about 200 to 220 meals each week. We also have had farmers come and deliver some produce for us. So we get to hand out fresh vegetables at a little farmer's market. Otterbein Church has started a little garden over the summer, and they donate some lovely vegetables for us. The Diaper Bank of Western PA still continues to donate diapers to us, and we continue to get community donations of hygiene items, paper products. So we're trying to do as much as we can, even though it's still a condensed drive-through walk-up. We make sure our consumers get what they need. We have not had as many emergency food calls, crisis calls, which we take as a good sign. We have had a few, as Jennifer had mentioned, seniors that are in the outlying areas that cannot come to the food pantries. So we certainly always refer them to the food bank. And there are a couple local churches that offer sometimes to deliver emergency food, so we utilize them. Our big concern and our big increase that we're seeing is in the homeless placement. It's really been increased. In the month of August, we placed 82 people for emergency stays in the hotels. And last year in August, we only placed 25. That really concerns us. And like everybody else knows on this call, housing issues, they just continue to become more complicated, and we are really grateful that the ERAP program has come about, and we work with Union Mission and Dan Carney. Anybody who has been affected by COVID, we certainly direct them to see if they qualify for all of the ERAP benefits. Unfortunately, a lot of our calls that come in, the people don't qualify for ERAP. They have circumstances that have led them to lose their homes, not because of COVID related things. So we work with WICSE. We've been getting a lot of calls from caseworkers at SPHS to do emergency housing for people until they can get some more secure transitional housing. So we're just trying to really reach out to all the agencies and partner as much as we can to make sure nobody falls through the gaps in that transitional time. And I'm very grateful for all of the agencies that partner with us. The only other thing I would really like to mention is we are having a fundraiser coming up next Saturday, September 18th. It is at Quinn Brewery in Irwin, PA, from 4 o'clock to 8 o'clock. It's a little bit of an outside picnic with a band and some refreshments and food trucks, just a fun afternoon. So if you want any more information, you can contact me or contact our website. And we would love to see you guys come. It's from 4 o'clock to 8 o'clock, and all we're asking is a $10 donation, and just come and have fun with us. Thank you all. I appreciate your time.
Thank you, Deb, so much for such a great update, and hopefully folks will take you up on it and see you at the brewery.
I hope so. Thanks.
Yeah. Next up, we have Dan Carney, Executive Director of Union Mission.
Morning.
There you go. Hi, Dan.
Hey, hi. I appreciate, again, just echoing everybody's comments about how helpful it is to have this morning together. So thank you for continuing to organize these calls. Give a few updates here. The Emergency Rental Assistance Program and kind of where we're at and where we're going with that. We have dispersed about $2.5 million in assistance to date, and we have budgeted a little bit over $3 million to go out to households at this point in time for that program. Really focusing on the transition from looking at a 12-month window to a 15-month window. Since we have the funding and the flexibility to do that, we've been extending out that assistance to 15 months for households that have been impacted. We do see, as was pointed out earlier, a need for utility assistance. A lot of what has happened is folks that we're serving were on payment plans and had significant balances sometimes before the pandemic, and so the review window or the period of time in which we can apply assistance is only from March 13th, 2020 forward, and so we can't often help with any pre-existing balance. And when their payment plans, when they fall through on those, sometimes the utility companies aren't willing to enter into another payment arrangement. And so we have been working with Catholic Charities a lot and connecting referrals and trying to pull together as many resources as we can for those folks. And sometimes the larger utility companies are willing to kind of renegotiate. So we try to advocate for that, but certainly see that as a need. We're working right now to roll out the application process online is weighted. And so based on certain answers and the federal priorities, applications are scored so that we can expedite the ones that need to be expedited. On our paper applications, we're working to get some things out to the local magistrates' offices so that the paper applications will also be flagged for us to expedite from the onset, working with people who are facing eviction. We've had a few magistrates' offices that we've been in contact with, and they've all been very cooperative, even with the CARES Rent Relief Program last year. And so far this year with the ever-changing eviction moratorium. I think most folks should know that the CDC's moratorium that was scheduled to be through October 3rd was pulled, and so we are now facing possible evictions for folks. So I'm happy to say that, applications as they're coming in, we've gotten some more team members on the team to kind of expedite that process and hopefully reduce the time it takes to process applications. We're also working on identifying some sources of funding that will allow us to hopefully pay out in a more immediate manner applications, and then still provide us the opportunity to process So a pool of resources to kind of plant that seed to stabilize households while we evaluate their eligibility for ERAP. So we're working on those strategies as well. And additionally, rolling out some more marketing and getting the information out on the streets. I think that when we look at our total applications, we're not sure if either folks are stabilized from last year, and we're seeing trends where folks are losing their job or struggling with income more recently, or if there are pockets that we're not getting the information to. So we're trying to work with some other groups that have some boots on the grounds in communities to get the information out there. Also, there is ERAP 2, and we'll be working, the funding should be coming in for that soon to the county, and that program, though it's a lesser amount of funding resources, does have some looser restrictions and can also help households for an additional 3 months for a total of 18 months, or if they didn't qualify for ERAP 1, potentially 18 months out of that program. Combined between the two programs, there's an availability for 18 months of assistance. So, we're hoping to get that underway as soon as those funds and everything is settled there. Additionally, the shelter programs, Welcome Home, the domestic violence shelter program, Blackburn Center, continue to operate and maneuver through everything that's going on. We're still working with the Housing Authority and Catholic Charities for some other housing and utility kind of interventions. We'll blink. This is my favorite time of year. I love fall, but we'll blink soon, then it'll be winter. And we have some scheduled meetings coming up for cold weather shelter preparations this year as well. And with the Delta variant as it is, we also are continuing to have available resources for the shelters to have isolation and quarantine support. So we still have that infrastructure in place, and we'll continue to make those changes and pivot where we need relative to emergency housing programs. That's kind of where we're at in the housing world. So thanks for the opportunity.
Thank you, Dan, so much. Thank you for such a great update. And it's pretty amazing that you guys have been able to get so much money out in the rental assistance program. So thank you for that. So next up is Dr. Fox, but she's not on yet. So I'm going to do a few announcements and hope that she joins. So a couple things. Edward, can you go to the last slide? So on your screen, you will see the dates for the upcoming calls. We did take a break this summer just because we had less information to share and fewer people attending the calls. Clearly, we had a lot of information to share this month. And so if you place those dates on a hold on your calendar, you should actually already have the invites for them. They should be on there. And we will sort of take it month by month and see if folks have information to share. Right, Alyssa, you're okay with that?
Sounds good, McCray.
Okay. And then a couple of CFWC updates. We have on September 17th, next Friday already, our Westco Nonprofit Network, our next monthly session, and it's from 9 to 10:30. And this month's topic is an update on the Reimagining Westmoreland, the County Comprehensive Plan. We're going to hear from Jim Smith and Jason Rigoni. And we actually surveyed the folks that have registered so far so that they can provide an update on the areas that most folks are interested in. If you want to register for that, you can reach out to Allison or Allison. I don't know if you can put the link to register in the chat real quick. The other update we have is that next Wednesday, our RFP and grant will open for our annual Healthy Communities grant project. So please be sure to check that out, and we'll be sending information out. That was perfect timing, Dr. Fox. I'm killing some time. So I am going to turn it over to Dr. Fox, and thank you so much. I know you've been running from meeting to meeting, so I appreciate you making time for us today.
Sure, and thanks for having me, and I apologize for being late. So just to give you a little bit of update what's going on at Excella these days, we have 39 patients who are hospitalized across our system, so they are in all 3 hospitals. We do have 8 patients on ventilators. Some interesting statistics of the patients who are hospitalized, 98% of them have not been vaccinated. And of our patients on ventilators, 100% of those individuals have not been vaccinated. So pretty good support for vaccination preventing, the most serious complications, which are hospitalization and needing ICU care and mortality. Of the tests that we've done in the month of September, about 14.2% have been positive, so that's certainly an uptick. Back in July, we had about 3 positive patients in our hospitals, and now, as I noted, we have 39. So that's a 300% increase in a short amount of time. In terms of the ages of individuals who have COVID-19 that we are testing, 53% of them are over the age of 50. So 47%, of course, are under the age of 50. And that's pretty significant because it used to be closer to 80-20. So we are seeing more younger individuals with COVID-19. When you look at the county statistics in terms of vaccination rates, for total vaccination, we're at about 50.5%. And for partial vaccination is about 57%. I think some good news is the over 65-year-old population, 77.4% are fully vaccinated and 95.2% are partially vaccinated. So, lots of people are partially vaccinated. I would encourage you to encourage anybody that you're with to please complete the full set of 2 vaccinations at this point in time. A number of people think, well, I had one, I don't really need another one, but you do really need another one. And of course, if you're, watching the news, it's likely that they're going to recommend a third one. We have already been vaccinating immunocompromised individuals with a 3rd vaccine at our Galaxy site in Norwin. That site is still open for anybody who hasn't had any vaccines, anybody who's had 1 vaccine. We do offer both Pfizer and Moderna. You do need to schedule specifically for which one you're wanting when you schedule. You can still do it through our website, www.excellahealth.org. And there's also a phone number you can call, and I forgot to write it down right now. So I will get that to McCrae so she can share that with you. I think we've shared it with you before. It's the same number. And when and if the 3rd dose is recommended, we will open for that. And we are open for individuals over the age of 12 at Galaxy. So if you have students that need to be vaccinated, have them and their parents schedule with us. I think those are probably the biggest things. We do continue to work with Alyssa and 211 and with EMS for our homebound folks to try to, ensure that they can get vaccinated and boosted or 3rd dosed whenever they need it. Happy to answer any questions, or I guess you'll put them in your chat, right?
Yeah, Dr. Fox, sorry, I got bumped off for a moment. So I'm not sure if you provided any data about the childhood tests or the rates of positive tests among sort of children.
I don't have a specific amount. The last time I looked under the age of 18, we were hovering around, it was around 13%.
Okay. Thank you. That's helpful.
Sure.
I'm going to see if anybody else I don't see anybody else with any other questions in the chat.
Okay.
All right. Thank you so much. I really appreciate that.
Sure.
Alyssa, do you have any additional closing announcements you'd like to make or share?
Nope. I appreciate the update from Dr. Fox, and we are still, as she mentioned, taking the calls from 211 for homebound vaccine appointments and getting those calls and scheduled through EMS. So really great.
Okay, great. Thank you all so much. I really appreciate it. We will see you next month on October 14th. And Edward, thank you for being our IT support and making sure we're up and running. Oh, wait. Allison's telling me we have 2 questions in the box, but Allison, I don't see them. So if you could read them, that would be great.
The first one is, are there any recommendations for early COVID treatment at home?
So in terms of early COVID treatment at home, unfortunately, the majority of treatment for COVID-19 is really supportive care. So we would encourage you to drink lots of fluids, use antipyretics, things like Tylenol to lower your fever. That tends to make you a little bit more comfortable. If you're feeling short of breath, you feel like you can't catch your breath, people notice that you look blue, you should contact your physician. They will guide you as to the next best steps, whether that is to see them, whether it's to have a virtual telemedicine visit, whether it's to go to the emergency department, you can do that. We do offer monoclonal antibody infusions. Those are for individuals who meet certain criteria. You have to be within 10 days of symptomatology. That's sort of the first criteria. And then you need to meet at least one of either being over the age of 65, having a body mass index of over 35, or have a series of comorbid conditions like heart failure, asthma, COPD, sleep apnea, be on dialysis, have sickle cell anemia, be on an immunosuppressant drug like chemotherapy or chronic steroids or medications that you might take, biological medications that you might take for something like rheumatoid arthritis or Crohn's disease, something like that, or have an immunocompromising condition. If you're not sure if you meet any of those criteria, if you speak with your physician, they'll be able to help you with that, and they can help get you scheduled through. We do it at Excella. We're infusing at the Frick campus. We do need to make an appointment for that. It's not a walk-in thing, and I know UPMC offers it as well.
The next question is are there any resources for homebound people to receive a flu vaccine?
You know, interestingly, we haven't really developed that particular resource as of yet. I mean, we do have a plan for COVID vaccine, so I think that's something that perhaps Alyssa and I and our flu vaccine team here at Excella, as well as EMS, could certainly talk about.
Thank you, Dr. Fox. Is that all you can see, Allison? I still can't see all of them. So,
someone is asking if the next call or the November call will occur on the 11th because it's a holiday. So we'll have to talk about that.
Okay. Yeah, we will probably maybe adjust that one, and we'll send an update to folks. Thank you. All right. Well, thank you, everybody, for hanging on and listening. And thank you to all of our panelists and speakers. And thank you, Alyssa, for continuing to partner with us to have these calls. Really appreciate it. Have a great day, everybody. Stay safe.
Bye.
Take care. Bye-bye.